And now give it up for my final guest, Carrie. So glad to have you here.
Thank you, Haley. I'm excited to be here.
Let's dive into some problems and solutions. Carrie, since you are a nurse, what are 3 diagnoses with short and long-term goals including interventions and evaluations for India?
The first nursing diagnosis I have is risk for infection related to limited healthcare access. The risk for infection increases due to the unavailability of resources that is available to the healthcare sector. The healthcare sector needs access to vaccines and other treatments to combat infestation with these preventable diseases. A short-term goal is to have members of the community participate in programs pertaining to disease prevention within a 3-month time frame. An intervention to expedite this goal would hosting forums in the community and provide information explaining why vaccinations and routine checkups are necessary in preventing and treating disease. The next short-term goal is to implement vaccination and wellness clinics for the residents. This could be achieved by collaborating with local organizations such as the Program for Appropriate Technology in Health (PATH) to initiate the vaccinations process and disease preventions. These will be achieved within 3 months, that is January 2019. A long-term goal is to expand healthcare clinics to the 90% of the vulnerable communities. This should be achieved within 18 months. This goal could be achieved by obtaining financial assistance from the government. To achieve this goal, the community would be required to become involved in decision-making and advocate for their right to health care. Evaluation of these goals will be dependent on the number of vaccines provided to the community and in a declining the number of preventable diseases. My second nursing diagnosis is imbalanced nutrition. Less than the body requirements related to lack of available food and water. Access to running water is one of the major problems of the Indian population. Lack of running water leads to waterborne diseases. This placed together with the unavailability of food leads to poor nutrition and depleted health status. My first short-term goal for this is to provide education on the importance of clean water sources in a 1-month period. This goal can be achieved by having nurses along with health organizations provide education to the resident. This could be done in the form of community-based seminars. The second short-term goal is to establish reservoirs of clean water and to start a water purification system for the community. An intervention to achieve this goal would be to collaborate with the government and local organizations to help support a program for clean water. This goal could also be achieved within a 1-month time frame. The long-term goal I chose for this one is to implement resources to maintain clean water resources. This would involve having the government seek outside assistance from organizations such as the United States Agency for International Development, USAID, to provide information and assistance with maintaining clean water systems. This goal would be achieved within 12-18-month time frame. Evaluation of these goals would be based on the surge of clean water and the decline in waterborne diseases. My third and final nursing diagnosis is knowledge deficit, related to limited educational and technological resources. A vast number of citizens lacks the resources to improve the country's infrastructure. These deficits make it difficult for the population to know what healthcare needs are necessary to prevent diseases. One of the short-term goals would be to have nurses start educational programs in the community to inform individuals on health risks and health promotions within a 1-month time frame. This can be done by hosting community meetings with question and answer sessions. The next short-term goal would be to have residents verbalize their willingness to adopt what they learn to their daily lives in a bid to decrease the incidence of illnesses. This can be achieved through resident participation in providing education to their communities. This goal can be achieved within a 1-month time frame. The last long-term goal is to make healthcare promotions easier and expand on technological resources. This goal can be achieved by getting the government involved by providing easier access to technological resources within a 15-month. These goals would be evaluated based on an increase of knowledge on disease prevention in the community and an actual decrease in the incidence of these illnesses.
Wow! There is definitely a lot of work to be done. What an amazing answer. Very thorough. Thank you so much for making an appearance on the Group 3 show.
Thank you, Harley. You're very flattering. Had an amazing time today on your show.